Other than effective communication, the number one thing that came through to us as people joined the group with those questions that we asked was not just effective communication, but it was actually retention. So it was actually how do I keep my people longer, really, is what that meant. And the challenges that we have with people who come in only for a certain period of time, typically till they feel better, and we're not sure then how we retain them longer and really show them the benefits of care beyond how they feel, or if we're seeing more of a conditions-based practice beyond how they start to function better around that condition that they may have, and then all of a sudden they go. So I think retentions are really probably a broad subject, but the common denominator in how we retain people is through a care plan. So we talked early on about the language. We do call it a care plan in our office. We don't call it a treatment plan. And we do see ourselves caring for people for the rest of their lives. That said, we don't start with lifetime care on visit one for a lot of people. We believe that people buy lifetime care a visit at a time. And because we believe that is why there's so much consciousness to every visit that we do in our office, because every time somebody is in any client practitioner model that they're purchasing, aka it's a business, it's a product and service they're really buying that each time that they're in your office. And so a care plan does a long-term goal and vision for somebody, but it's broken up into individual visits each time that they're there. And so tonight what we wanted to do is just talk a little bit about the concept of how people make decisions for sustainable change. And I think that we probably don't spend enough time in chiropractic understanding people as much as we need to, even though we are in a people-oriented business. And I believe the more that we can understand people, the more effective you can become at care planning, and the more effective you can become at really showing people what's possible for them beyond the obvious perceived problem they have when they first come to see you. Early on, I guess we could tell our story about care planning early on in our practice. First of all, we didn't care plan. So the first evolution of our care planning was there was no care plan. So the life cycle was very short. Today, we wouldn't necessarily call that a care plan. We would call that fighting for a visit at a time. Meaning that each time a person was in, we were sort of, Don used to talk about, well, I was just hoping that, okay, at the end of this visit, I got to prep myself to get them to come back for another visit. I'm not sure why they would come back. I think I can help them, but we weren't really clear from the get-go as to what that would look like long-term. Then, as you remember from the last presentation, he turned into the Hulk. We got a bunch of coaches who said, you know what, if you're not doing a year of care, you're doing a disservice to people, you're a terrible chiropractor, people need to buy hundreds of visits, and they need to pay for them monthly, and that's what you need to do to make sustainable change for people. So that's what we did. At the time, we were allowed to do that. It has been very helpful for us to practice where we are today because we are so restricted in what we're allowed to do with care planning today. Now, I just got to clarify, care planning for us has nothing to do with money. So in chiropractic, those two words are used interchangeably. The finances that support a care plan are very separate for us. So when I'm talking care planning, I'm talking exactly that. I'm talking about the care we recommend for somebody over a period of time. That's what we call a care plan. So then we tried the long-term force them or fire them model of care. And it worked a little bit. It certainly helped our numbers in practice in that period of time. We certainly got some results with people, but we did lose a lot of people. So perhaps our care planning was a life cycle over a lifetime for somebody. And if we were to look at care planning completely different, which is what we did in our practice, and we took away all the phases of care, and we took away all the phases of care planning, and we stopped calling them terms like we did early on, where we called it pain relief, we called it stabilization care, restoration care, prevention care, maintenance care. What else did we call it? You name it, we called it. You pick any cool name for a care plan phase, and we called it that. The problem with the phased idea is there's an end to a phase. And so when people got there, they were done. And so our retention would automatically match our phases of care. We were the most successful, as most chiropractors are, the first couple of phases of care. So we thought, let's just take everything we know, throw it out the window, and let's try something different. Let's look at care planning as a life cycle. And let's look at it as a life cycle of care through which somebody travels in our office. All the way to our ultimate goal is that somebody does stay under lifetime care, but we are still going to be doing that a visit at a time. And every time that somebody is in, we're going to continue to elevate this idea that we are looking at this improved vitality. And therefore, with that improved vitality, we ultimately see that top of that hierarchy or the mountain, which is our entire education process, is using that hierarchy.